You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic. We have the most questions about this topic, and that is liposuction. Is it safe? New techniques allow for a smoother result, and you can even be awake during the procedure. So if you have unwanted fat that you can't get rid of with diet and exercise, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is Dr. August Accetta. Dr. Accetta, welcome to the program.
Thank you, Randy. It's a pleasure to be here.
Now, before we get into today's topic, tell me a little bit about your practice.
Well, I've been in practice for 20 years, seeing women of all ages, and in the last 15 years, I've been focusing on the aesthetic appearance of patients. I started in pelvic reconstructive surgery.
Okay, now not to get sidetracked here, but you have an affiliation with one of the doctors, I guess, on 90210. Tell me about that.
Yeah, I'm very proud to say I'm an affiliate of Dr. Matlock, featured on Dr. 90210.
Yeah.
At first I had a problem thinking, as a pelvic reconstructive surgeon, what can a gynecologist teach me? But in fact, he has some of the most excellent results in vaginal and very private area aesthetics, and he actually did teach me.
He does liposuction as well, a lot of liposuction?
Yes, he does liposuction, and just last week he had a program on high definition Vaser Liposuction, which I'm excited to talk to you about.
Vaser Liposuction, that's what we're going to talk about today. So is that what's new? You know, we talk about, what people need to know about liposuction. What's changed? I mean, what's changed over the last, 15 years?
Randy, one of the biggest concerns I get from patients about liposuction is they'll tell me that they've seen it on TV and it looks gross and it looks very traumatic. And I'm very happy to say that over the last 5 years, a form of liposuction known as Vaser, which is an ultrasonic form of liposuction.
Are you still sucking, though? I mean, you're still sucking the fat out?
Well, we are, Randy, but it's what we do to the fat before you remove it. One of the biggest concerns about liposuction is getting what's called contour irregularities.
Bumps.
Bumps. They don't get the smooth result. With Vaser, it liquefies the fat without disturbing.
By heating it?
It's an ultrasonic acoustic effect. It fragments the fat cells. It creates a liquid of the fat. But the important part, it does not touch the blood vessels and the nerves. So these patients don't get very much bruising. They don't get paresthesias or numbness. And most importantly, they get a smooth contour. So once it liquefies, you go ahead and then you do remove it. But you can look at histologic studies where you can see under the skin, there's no more fat, but the blood vessels and nerves are left intact.
So it's not gimmicky. I mean, this is not to be confused with these injections or anything like that.
No, not at all. As a matter of fact, it's the biggest fad going through Hollywood right now. And just last week, Dr. Matlock did a high-definition Vaser on a very popular rap star, and he did an excellent result. And
so high-definition lipo, that's what you're doing, and that's what's new?
Yeah, that's the main thing that's
define
new.
that. What does that mean? High-definition liposuction.
High definition is true body sculpturing. That's why you have to. That's why you have to be an artist. You're really not just removing fat deposits. You absolutely have your own artistic, some say, Leonardo da Vinci approach to the body, and that's why the surgeon must, whoever you see, you want to see a surgeon that truly appreciates the aesthetic beauty of the woman, because as some pictures I'll show you, all women have this beautiful hourglass shape underneath.
You just have to get to it.
In fact, you just have to get to it.
Do you think the perception is that everyone's doing liposuction? All the doctors are doing it the same way?
Yeah, I think the public perception is that liposuction.
That's just not true. It's that different.
They think liposuction is liposuction, but there are really three major types of liposuction. There is the traditional tumescent liposuction, which everyone has seen on TV.
Okay.
But what we're really excited to talk to you today about.
But that works too. That works, right?
It does work, but we're really excited to talk today about is the advances of liposuction.
Right.
What's new? What's new is Vaser. Vaser is an ultrasonic method of breaking down the fat without disturbing the blood vessels and nerves, and lending itself to such a more rapid recovery, a smoother result, and also lending itself to do high definition. And
high definition lipo.
High definition are these people that historically used to be excluded as not needing it, but they come in and maybe their body bodybuilders, but they still have pockets of fat, or maybe they just can't get the definition that they've worked so hard to get. And Vaser will go in and liquefy that fat, and then you do remove it.
Okay, so are you combining all three?
Absolutely. We are combining all three, and that's the key. We own all three types. We do it completely awake. And that's something that's, yeah, completely awake. Now, there are patients that are so nervous about being awake that we will use general anesthesia. But to keep them awake, you go a little higher on the anesthetic lidocaine, and you're able to get them extremely comfortable. And keeping these patients awake, for me, is...
You say you talk to the patients, you say, while they're having the procedure done?
Randy, they do so well. I've trained under numerous plastic surgeons, and they all told me that their staff was very nervous to do their first patient awake. But after you do a patient awake, the patients do so remarkably
well. Is it safer, though?
It is safer.
Why?
You're omitting the risk of general anesthesia, which pretty much...
Is liposuction safe, by the way?
Liposuction...
Because there's a lot of bad press about liposuction lately.
As a gynecologist, we perform a lot of procedures with laparoscopy. Laparoscopy is a safe procedure, and most women know what laparoscopy is, but liposuction has 1/10 the risk of a common procedure a young girl would go in to treat endometriosis.
So if the right patient, if they're healthy, it's a safe procedure.
It's very safe, and the point, Randy, is to keep them awake lowers the risk almost 90%.
Is that your place, though, as a gynecologist, to be doing liposuction?
Well, I did do 2 additional years of pelvic reconstructive surgical training. However, Randy, remember that the founders of liposuction were 2 French gynecologists.
Is that right?
Dr. Illouz and Dr. Fournier. And when they came to the United States, they actually started to train plastic surgeons, and therefore the gynecologist, even though the inventors were gynecologists, it wasn't really something that the gynecologists started with in the 1980s. But now, I believe that, as I mentioned earlier, that a gynecologist, and we do have enormous respect for plastic surgeons.
Yeah, you work with them.
We really do. We work with them. Now, most of them I know don't really have a passion for
They don't like lipo.
They don't like lipo.
We talked about that. You know, our show airs nationwide. I've had hundreds of doctors on the show. I've met 2 other people besides you that like liposuction. Why do you like it?
I like liposculpture because you get the results immediately. The patients are happy. I tell patients, for years I used to get cards from patients that were happy because of their hysterectomies or their bladder surgeries, but nowhere near the excitement and the appreciation that we give women by changing their lives.
Is it still the #1, or I at least hear the #1 cosmetic procedure, liposuction?
Yes, it's probably the most popular cosmetic procedure because it works, Randy.
What type of people are coming in for liposuction?
We get patients of all types, Randy, but primarily women and men between the age of 35 and 55. And they're every walk of life, but primarily the businesswoman, the woman who has worked so hard to raise her children, achieve her goals. She wants to present herself well. And we have results that have really changed.
Do tummy tuck as well?
Yes.
Now, when does somebody become a tummy tuck and not a liposuction patient?
Well, a patient comes in and has a lot of skin laxity or excess skin. If you remove that fat, Randy, it's going to make the skin look even worse. So if a woman really cannot get the skin to tighten, for example, here we have a lady in her 40s. This is a typical tummy tuck. Look at her love handles and how the overhang of the lower abdomen protrudes. This is a lady who's tried diet and exercise. She's a very strong, professional woman. Look at her back. The hip rolls protrude from the back to the sides, and this is why a woman like this would need an abdominoplasty, because the lower abdomen protrudes and actually hangs down. If you just remove the fat volume from that area, it will not make it look better. This lady ended up with an abdominoplasty with...
That's a tummy tuck.
That's correct, with aggressive liposuction. Look at them side by side. You can see that this here is...
doesn't look like the same person. I mean, very fit look. Looks like she lost about 30, 40 pounds.
Very athletic, very sexy, and she is able to now fit in clothing she's not fit in for 10 years.
What do they say, by the way, after this procedure? I mean, because that is dramatic.
Mostly they say their lives have been changed. they're more motivated to get back to exercise, to maintain the look and perhaps even improve on the look, whereas they were having difficulty with motivation prior to having such a drastic change in their body. There's a huge difference when someone's wearing a dress. If you look at the side profile and the hourglass figure, you cannot get the hourglass figure, Randy, without aggressive liposuction, and that's what you had mentioned earlier. You must find a surgeon that is proficient with abdominoplasty and liposculpture.
And why is that?
Well, if one size doesn't fit all, if a person...
I mean, is it possible if this woman came in to a doctor that doesn't do tummy tucks, that she would have just got lipo?
Absolutely.
Okay, and what would have been wrong with that?
She would have looked better, but she would not have gotten anywhere near the cosmetic endpoint that she would have really been striving for.
Now, is this one of those high-def lipos, by the way? Because you could see a little bit of abdominal muscle here.
Well, in fact, it's not. We were very aggressive with her liposculpture, but for this particular patient, we didn't use Vaser. We try to use Vaser if we're going to take out less than 2 liters of fat. And there are some...
Is that a thinner patient?
A thinner patient.
Because, you know, we've seen the celebrity photos, by the way, in the tabloids that show this bumpy, thin look. Is that the problem with doing thin patients? You're going to get the bumps?
Absolutely.
And does the Vaser almost eliminate that?
Yes, the Vaser does eliminate most, if not all, of the what's called contour defects or the bumps.
We're going to take a quick break. Time for one more photo. What are we looking at there? That one looks pretty dramatic.
This is dramatic. This is a 46-year-old lady who hasn't shown her body in the light to her husband for 15 years.
How did that happen, by the way? That look?
This lady lost 85 pounds, and unlike some that they just get some laxity of the skin, you can see that her skin was greatly damaged. And interestingly, Randy, she came in with very low expectations. She said she's not shown her body to her husband in the light for 15 years, and if there's anything I can do to help her look better, and normally we try to under-promise and over-deliver. That's a general philosophy in cosmetic surgery. You don't want to over-promise. But I knew I could give her a better result than she thought she could get.
Do you see the end result in mind sometimes when you evaluate a patient and you know, wow, this is going to be good?
I think you have to see the end result. And I believe most women have an hourglass figure underneath whatever adiposity or fat or heavy skin that they have. With this lady, it was a little more complicated. She not only needed an abdominoplasty for her excess skin, but she needed aggressive liposuction to give her the hourglass figure. And notice down here, she has some hip rolls that, again, just with liposuction here and abdominoplasty here, you wouldn't have gotten rid of this. So
her belly button is gone.
Her belly button is gone, and the ultimate result is an hourglass shape, which you can see here in this picture.
Wow.
And this lady was so happy. She can't give me enough thanks. Very, very grateful.
So what do you do with all that skin? I mean, do you cut it out? Help me understand what a tummy tuck does.
An abdominoplasty is the dissection of the skin and the fat all the way up to the xiphoid, which is the breastbone. You actually go beyond the lower ribs just a little bit, and then you plicate the fascia. You have to understand that after childbirth, even if a person doesn't get a hernia, their fascia, which holds their girdle together, does get distended and stretched. So a true abdominoplasty, you need to plicate.
So the muscles are separated?
The muscles are separated. It's called a diastasis. If they turn to the side, even if they're very, very thin, if they turn to the side, they have that bulge, which comes after childbirth.
And that's the muscles.
The muscles. So you need to go in and...
So you tie those together?
You plicate the fascia, not unlike a corset in the old Western days, and you do that above the navel, and you do that below the navel, and sometimes even obliquely on the sides you need to plicate the fascia. And then one of the most important parts is to give them a navel that they're very excited about. Both of these ladies, their navels were stretched out, and now they end up with what we call Versace style navels.
So this is this is definitely an extreme makeover. What is a woman like this? I mean, her life has to be changed after that.
This lady is now wearing low-cut jeans. She's now very proud to show her body to her husband, which he has not done, remember, for 15 years.
Okay, we're going to take a quick break. We come back. You have more photos. This is very dramatic. And is this a typical patient, though, or do these represent just unusual cases?
I believe most, if not all, women have this hourglass figure. They have all at one point been 18, 20 years of age, and really time and trauma such as childbirth, which is a wonderful thing. However, these ladies deserve to recapture much of their original beauty.
Okay, what areas of the body? We talked about abs, the love handle area. Where else are you removing fat?
Well, in many parts, Randy. You can do the male excess breast tissue. You can do under the arms, bra areas of women that are very conscientious about.
So the fat on their back? Is that I mean, that's an area that
all the way down their back. We can remove fat from the buttocks region. We can add fat to the buttocks region.
What about arms? How well do arms treat?
Arms are very well treated with liposuction, unless it's a very extensive amount of fat. We can use Vaser and laser liposuction, because remember, Randy, it's the Vaser and the laser liposuction that once you remove the fat, you can go directly into the skin and tighten it. And with laser liposuction,
so you remove the fat, then afterwards you go in with the Vaser. I mean, same day procedure.
Yeah, remember the Vaser is a two-step process. First, it's liquefying the fat, and then after you remove that liquid, you go in and you can tighten the skin with the Vaser. But even more importantly, Randy, with small areas of the body, such as the underarms, the jowls, the neck, we're using laser liposuction, where you can actually see shrinkage of the skin before your very eyes. And until laser liposuction or Vaser liposuction, that was not an opportunity for patients.
So cellulite. You say that this is a great treatment. There's hope for people with cellulite. Because I've been told, I've had doctors on the show that say, well, Randy, don't bring up cellulite because it's not good for cellulite.
I believe, based on the patients that we've treated and some of the pictures that you can see here in a moment,
I mean, do you have a photo of thighs?
Yes.
Let's take a look.
I do. I believe the problem with cellulite is that it's been misdiagnosed. When you do liposuction, you'll notice that there are tiny string-like bands that attach underneath the skin, and they go down and they attach to the muscle. It's essentially why your fat stays in place if you're going to sit on a sharp rock, that your fat doesn't migrate. You have fibrous bands that keep the fat in place. When people gain weight, those little bands pull on the skin, what we call the epidermis, and creates the dimpling effect. So when they're talking about cellulite as a special type of fat, I think they're missing the point. My friend in Florida, Dr.
They mean the medical community.
Well, I believe it's true, because a colleague of mine in Florida, Dr. Bafidis, invented a technique and a tool to break down those bands very effectively, and you can see for yourself 90% of this lady's cellulite is removed.
This isn't touched up.
That's absolutely not touched up.
It's well lit here. So you use liposuction and the Vaser.
Right. And then a special tool invented by a friend of mine in Florida. And what you're doing is we're breaking down these epidermal, they're called epidermal bands, and then they will heal. They will heal.
Is this a temporary effect? Because I know there's techniques to swell the legs so you have less appearance of dimples. This is not like that.
No, this is. I think it's been misdiagnosed in the past, because we have numerous patients now that maybe they'll just come in for removal of their cellulite. So we use the same tumescent technique. We'll break down those bands. We'll bring out some of the fat, and then we'll give back some of the fat to create a smooth appearance. But it's by breaking down those bands, which in a tissue way, which we call histologic way, we're able to remove the mechanical force that pulls on the skin.
Now, and on the program, we're going to have a legal disclaimer, and I have to tell people this is a real interview. You're not scripted. You know, we didn't plan this, but it'll say results not typical. Is that typical?
In my practice, Randy, it's very typical.
Like what?
We expect 4 out of 5 patients to get these results.
To get this kind of results?
And they do.
Now, some people, the cellulite is so bad, they can't do it. Or maybe that's not the case. I mean, can you be too far gone with cellulite?
Well, I think you're always going to get a dramatic improvement. This lady got a 90% improvement. If you improve patients 50, 60, 70%, most of them are very, very happy.
All right. Okay, we're going to take a quick break. And you have more photos.
Yeah, we have more.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you're considering liposuction, you have to hear this next segment. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger, an advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, liposuction, a new technique that is offering much better results, I guess, than just, as you say, tumescent liposuction.
Yeah, traditional liposuction is wonderful. We're not saying we're replacing it.
Because you do that.
We do that, and we reserve that for patients that need more than 2 liters of fat, 2 to 3 liters of fat. With Vaser, we have to remember that this is a physicist's dream. They created the acoustic effect of ultrasound to disintegrate the membranes of the fat cells, liquefy the fat, not disturb the blood vessels and the nerves, giving a smooth appearance, less bruising, less numbness, a quick recovery of 1 to 2 days, and it's really, and we're able to do high definition. And the last photo I'd like to show you.
High definition liposuction, okay.
Last photo I'd like to show you is a young man who most would say didn't need it anyway, but for him, he did not like his love handles. He had some fat in the back, and you can see just 5 weeks later, this gentleman is extremely happy. He's one of my dearest patients right now, and we were able to give him
kind of chiseled some six-pack.
Chiseled some six-pack, and it's, again, the biggest thing
so
going.
ask your doctor, are you doing Vaser lipo?
Absolutely.
This is good stuff. But a recap on the Vaser liposuction. What are the big benefits?
Well, remember, they get to stay awake. They get to participate. We empower them to participate in what they end up with, okay? They really give us a lot of
So is that
input.
a fear out there? They don't want to be put out completely?
Well, I think that there is a role for general anesthesia, but even our more nervous patients have not regretted staying awake. Now remember, with our abdominoplasty and various vaginal procedures, we put everybody to sleep and we do some liposuction. But with straight liposuction, the fact that they can stay awake, lower their costs because they're awake.
So it's less expensive.
It's less expensive.
Because you don't have to put them out.
It's less expensive because they're not paying for a hospital and they're not paying for an anesthesiologist. It's safer. We all know, patients know that the risk of surgery is primarily an anesthetic risk. That is eliminated. And then the recovery time, Randy, it's not a painful process. They take, the first day they might take something like Vicodin, maybe, most of them don't, and then the next day they take Motrin, and most importantly, they're back to work in 1 to 2 days.
Okay, and your message is if you're going to get liposuction, go to a doctor that at least
go to a doctor, Randy, that definitely can give you an abdominoplasty if you need an abdominoplasty. And make sure that you see his work, make sure it's not doctored up work, make sure that that doctor, and you can...
So at least you have your options.
You have your options. You want to make sure that doctor definitely has an artistic point of view.
And we haven't talked about thighs, but you can do thighs, knees.
Now thighs...
And are those common areas?
That's an important question because thighs, circumferential structures, circular structures, are more difficult than a flat structure. Simply doing the upper and lower ab still takes skill, but not the skill of doing the underarms, the back of the under bra area, the thighs, the knobby knees that they don't like. A circular structure adds a third dimension, which again, you can achieve great results with a good surgeon, but Vaser once again helps to give you that smooth appearance because once again you're not stripping cords of fat out, you're liquefying the fat, and that as liquid has a smoother context than fat.
I want to go out of my way. I always say I don't endorse the doctors that come on my show, but visually, these photos, and I've seen a lot over the years, are the best I've seen, or at least
Thank you,
one of the
Randy.
best I've seen.
I really appreciate your professional opinion.
So if somebody, now what's wrong with diet and exercise, by the way?
Well, diet and exercise is excellent, but as you know, once we get about 40, I don't know what your age is, but I'm a little bit over 40, our metabolism slows down. And I know people that exercise 6-7 days a week, and they cannot lose fat in certain genetic areas, and just to touch them up with maybe high definition Vaser liposuction, or sometimes
so Hollywood is hot on this.
Hollywood's
Vaser
hot,
lipo
biggest
is
thing. It's featured on Dr. 90210 just last week. A high definition Vaser.
So, okay, so Vaser, ask for Vaser.
Ask for Vaser liposculpture.
Not a lot of guys have this machine, I guess.
No, not for those that own it in their offices. I know many hospitals have it, but then again, those are patients that need general anesthesia.
This is a $120,000 machine, about?
Yeah, about $120,000 machine. Basically, though, what we're really encouraging people to do is Vaser liposuction awake. Give yourself the opportunity to empower yourself and leave the risk behind, the risk of general anesthesia.
So what do they ask on the consult? I mean, what are their fears?
The fear is that
you hear every consult.
They believe it's more dangerous than it actually is.
Okay.
And again, I gave an example earlier of laparoscopy, which 1 out of 5 young ladies undergo laparoscopy, which is a very safe procedure. But liposuction is much, much safer than that. So their fears are that it's dangerous. Many of them are afraid of general anesthesia. Most of them, though, tell me, Randy, that they think that liposuction is barbaric. And compared to traditional liposuction, Vaser is a piece of cake.
But it seems very painful. I mean, it seems like
it's much less painful than any of them imagine. They're laughing during the procedure. Remember, they're talking to me.
What about the next day? I mean, how soon could they go back to work?
The average recovery time is about 1 to 2 days, but they are on Motrin, i.e., they're not on narcotics after the first day.
Safety. How? I mean, what systems do you have in your office, and where are you doing the surgeries? This is in one of your ORs?
Yes. Well, actually, we have a very nice operating room in our facility. We have the patients monitored all throughout the procedure, monitored after the procedure, and the one point I wanted to make is within 30 minutes after they're done, they're standing up in my hallway waiting to go home.
Okay.
And the next day, I ask about symptoms and pain, and most of them tell me they did not experience much pain at all.
Okay, great. I want to thank you for coming to the show. Very good stuff.
Thank you very much.
Good photos. Good photos.
Thank you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online or direct a friend to it, you can visit our website at wellnesshour.com. You could do a search for lipo, and you'll see the doctor here. So for now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.